Hey, what's up guys, it's Trent with Revive Physiotherapy, and apologize, a little sweaty, literally just got done working out, but wanted to shoot a quick video and talk running related injuries. So as you can see on the whiteboard here with a lot of information today, we're just going to cover one part of this. So first things first, is there a correct running form? Well, as most things in the fitness and the rehabilitation, it depends. So there's not a correct form, but it depends. And what I mean by that is, the first thing here is, oftentimes we have folks that come in and they complain of this pain or discomfort on the front part of the anterior part of their lower leg. And what I find typically is that these folks are the ones that are really overstriding as they're running. And when I'm overstriding, you can see that I'm having excessive heel contact. Now what that does with excessive heel strike is it basically forces this muscle to work every time I bring my foot down to the ground. And so basically it's overloaded, that front muscle. So a couple of cues that I like to use to reduce some of that is to stay up nice and tall. So when you're running, you're not running down here, you're staying up a little taller. Thinking about piston action with your hip, so by increasing your hip flexion here as you're running, you're not going to reach out as much. And the third one is to increase your step rate. So by increasing your step rate, or how many steps you take in 60 seconds, you'll essentially decrease how far you're reaching. And then 3 universal recommendations that I like to give to a lot of runners. The first one is to increase that step rate by about 10%. So again, by increasing the step rate, it'll decrease the step length, which will reduce that overstriding. Second one is strength. So not only just getting stronger, building your muscles from a hypertrophy or getting bigger standpoint, but increasing your muscles' resiliency or their ability to reduce or to resist some of the injuries. And the third one here is volume or load management, so not increasing your mileage significantly week to week, but gradually building up. And then to finish, 2 quick things. A lot of folks ask about what type of shoes they should get. My recommendation, get something that's comfortable. A lot of that comfort and anti-pronation stuff doesn't matter as much, so something comfortable. And then obviously with any injury-related things, there's always red flags. So be sure to seek out help. Don't just Google and self-diagnose. So that was the front part of the lower leg that we talked about today. Next week we'll discuss the back part or the inside of the leg and some things that you can work on to reduce some of those symptoms you may be having.